recorded, and where is my pen? Okay, so now the final position is the same, which is VPL, okay, ventroposterolateral nucleus of the, and then we reach to the sensory cortex. Okay, so this is how we go with the spinothalamic tract. Okay, let me take you to this. Let me clear this. So we have read both of these tracts. Okay, let's give it a read from BRS 2. Okay, in the BRS book, we have this anterolateral system processes sensation of temperature, pain, and light touch. Okay, consists primarily of group 3 and 4 fibers. I told you them, which enter the spinal cord and terminate in the dorsal horn. Okay, dorsal horn of the spinal cord, the posterior horn. Okay, now what is the course? The second, now this was the first order neuron that was entering the spinal cord and terminating at the dorsal horn. Okay, now the second order neuron crossed the midline, as I show you in the picture, to the anterolateral quadrant of the spinal cord. Anterolateral quadrant. Okay, now this is your spinal cord, this is your butterfly shaped gray matter. Okay, we have two nucleuses. One is this, the anterior one, okay, and one is this, the lateral one. Okay, we have two nucleuses, the anterior nucleus and a lateral nucleus. Okay, and the course of pathway is the second, we are talking about the second order neuron. Okay, from here the second order neuron will the first order neuron comes from here to here. Okay, and the second order neuron will cross this midline and it will reach to the lateral, and it will reach to the anterior. Make yourself clear. Okay, one more time I will draw it for you. This is your effector organ. Okay, from your effector organ, this is your dorsal root ganglion. Okay, from your effector organ we go to the dorsal root ganglion, then to this lateral nucleus, or we go to this nucleus. Like there are two separate ones. Okay, if you're talking about the antero system, we are talking about this. If you're talking about the lateral pathway, we are talking about this. Okay, and from here it will goes to here, or it will go to here. So this pink one was the first order neuron, but now we are talking about the second order neuron in this course, and from the dorsal horn we are crossing this midline and we are going to the opposite side. The second order neuron is decussating. Okay, and it will reach either to the lateral or to the anterior white commissure. Okay, the white matter, not the gray but the white. Okay, from the gray it is reaching the white. Remember this thing. Now, and ascends to the contralateral thalamus. Now when it reaches to the anterolateral quadrant, of the spinal cord, okay, from here these fibers will go up to the thalamus, but opposite thalamus. So this was right and this is left, so contralateral. Okay, they don't mean that from left it will go right. No. The decussation only happened one time. It does not happen two times. Okay, so this is like one time, it's done. Now it will not happen high up there. So remember this. Okay, where they synapse on third order neurons, and then third order neurons ascends to the somatosensory cortex, where they synapse on the fourth order neuron. So now from here they will go to that post central gyrus. Okay, and from there we will get, it will be transferred, the sensory pathway is finished, the sensory will connect to the motor will bring back the response. Okay, but now we are not studying motor, so you have to understand this thing at this level. Okay, now I will take you to the picture which we saved. Okay, now if you see in this picture, this is the most simplest picture, and then we will cut the sections. Okay, so if we talk about this picture, now it's like big on your mobile screens. So this is your sensory ending or your effector organ. At the level of effector organ, you see this is the first order neuron, and this should wait a second, this little thing in this is a, there's a little dot present over here. Okay, there's this little dot present over here at this level. This is your ganglion, this is your dorsal root ganglion. You see this bulge like this, and this is your dorsal root ganglion. So it reaches the dorsal root ganglion. From there, it enters into the dorsal horn of your dorsal horn of your spinal cord. But you know, this is all one side, like ipsilateral. But then it crosses and it reaches to the white matter, and from there, now you can take it as medulla oblongata if you're talking about the dorsal column. But if you're not talking about the dorsal column, then this should be any segment, but not medulla oblongata. Okay, from there it reaches the pons, and pons to the midbrain, and to the midbrain to this thalamus. So this is the thalamus. Okay, this is the thalamus. So it reaches this thalamus, and from this thalamus it synapses with the third order neuron, and it goes to this somatosensory cortex region. This is the central sulcus, this is the postcentral gyrus, this is the precentral gyrus, and this is the sensory one. Okay, this side is for the motor one, this side is for the sensory one. Okay, so I think this story is now more clear to you in a proper diagram. Okay, so now if we cut sections, if we cut this portion into sections, like we take one section from the midbrain, we take one section from the pons, we take one section from the medulla oblongata, and one section from the thoracic segment. Okay, and we study it that way. We have this another picture. Okay, we have this another picture. In this picture, you see, this is again, this is your dorsal root ganglion. Okay, dorsal root ganglion, this dorsal horn of spinal cord. From here it reaches to the contralateral side. So this is your first order neuron, but this little buddy inside the spinal cord is your number 2, and then this number 2 is going from here to here. This is your thalamus. So it is going from here to here, your thalamus, and then from here to here, this is your number third neuron. Okay, so now what is going on is, you see, this is the thoracic part of spinal cord, like thoracic segment. Now this is your lower part of medulla oblongata. So this is your medulla oblongata segment. Okay, in medulla oblongata, and then this is your upper part of medulla oblongata. Okay, this is your pons, this is your midbrain, and then this is your brain, and then this is your thalamus, and then this is your postcentral gyrus. Postcentral gyrus. So everything is like clear now to these levels. Okay, and if this is decussating, if the second order neuron is decussating at the level of thoracic part and not at the level of medulla oblongata, which tract is this? Which is this tract? Is this a dorsal column tract, or is this an anterolateral system? This is an anterolateral system. Okay, this is an anterolateral pathway or anterolateral system. If this picture would have been of your dorsal column tract, this number 2 will not be present at thoracic level. This number 2 will be present at this level. Okay, from here to here, number 2. So then this pathway would be your dorsal column pathway. Okay, and from here up till here we have this number 1. This thing will not be there. This thing will not be there. This side will not be there. It will be like this. Okay, so you have to understand these two concepts. Okay, I have another picture, this one. Okay, now when we talk about this picture, you see the labeling, for the labeling. Okay, now when we talk about this, there is a word which is, I keep this picture for only this word. Okay, so you there are some wordings in your neurophysiology. Just remember this: posterolateral tract of Lissor. Okay, we this posterolateral tract of Lissor, like what is this? Like, now you might have been getting an idea of what we are talking about, but if I have to like kind of explain you what is this posterolateral tract of Lissor, the fibers that before decussating to the posterolateral side, before decussating, these fibers, they form a tract over here, very small. Okay, they call it posterolateral tract of Lissor. So just remember this word. If anywhere you find this word, your mind should go at this particular region, okay, before decussation. Okay, but that's a very higher level. So even if you want to forget it, like, you can. Okay, and then you see this whole thing is going on, and now there was this word spinal lemniscus, medial lemniscus, lateral lemniscus. So at this region, at this particular region, there is not one tract, there are many tracts. Okay, so you have read two tracts just now. One is the dorsal column, and the other one is anterolateral pathway. So one tract is this, second tract is this. Then we have this another tract which we called, I guess, spinotectal. I'm not sure, but I will check. Like, it may skip from my memory, but I will check it. Okay, so we have these 2 or 3 tracts that go from the same pathway. Okay, and when we are talking it medially, like you see, it is near the midline, so that is why we are calling it medial lemniscus. Okay, but if we go further away, it will become lateral. Okay, if I go further away, it will become a lateral. So near to the midline, that is why we are calling it a medial lemniscus, but as a whole you can say it's spinal lemniscus too. Okay, so now you understand all these terminologies that were written over there. Now one more thing is this: you reach this thalamus, and from the thalamus we have an internal capsule. And if for understanding internal capsule, brainstem, the whole brainstem, go to my first and second lecture from neurophysiology in the recording section, and I explained you brainstem, complete brainstem, including the amygdala, not starting at the brainstem, basal ganglia. I'm sorry. I explained you the complete basal ganglia. Okay, the thalamus, the hypothalamus, the infundibulum, that pituitary stalk we call infundibulum, the pituitary gland. Okay, I explained you all that anatomy, and the third ventricle, the amygdaloid body or amygdala, the caudate nucleus, the lentiform nucleus, the internal capsule. I explained you every little tiny thing, the globus pallidus, sputum, and everything. Okay, so go to my first and second lecture and hear those lectures for your basal ganglia anatomy. Okay, in your neurophysiology folder of your Google Drive, the first and second lecture. Now Then these fibers are somewhere called corona radiata, but that's a big detail, so just leave it. And then you reach the somatosensory system. So now I'm going back to our book. Okay, so let's not waste too much time here. Okay, but this was our main topic for today. Then we have some other things like, now we will quickly go through. Now you see this number 2 is again the mechanoreceptors for touch and pressure, but I have already taught you it from from your first aid book. If you remember, this is the same chart of Pacinian, Meissner, Ruffinian, Merkel disc. But in your BRS, it's not given so good. So I will recommend you to study these charts from your first aid book. Okay. Have I lost the track of the chart? No, here it is. So you see, read the chart from here, from your first aid book. This is your chart, okay? And I guess this is page number 494 of your 2020 edition. I don't know the page for 2019. This is 2020 edition. Okay, so this chart, you can even take a screenshot right now of your screen. So this chart is important for your PMDC exam also. So I have explained you this in, I guess, either Monday lecture or either in Tuesday lecture. Okay, so just check the previous 2 lectures if you have missed for it. So this is very important chart, and this is the same chart from this BRS, but study it from your first aid. Okay, so because we have done this, so we will not repeat this, and we did this one whole lecture on it. And now thalamus. So the thalamus, when at the level of thalamus, information from different parts of the body is arranged symptomatically. Destruction of the thalamic nuclei. Now there are 5 or 6 thalamic nuclei, okay, results in loss of sensation on the contralateral side of the body. Now this is important. If you're, now this is your midline, and this is your brain. Okay, now this is your right thalamus, and this is your left thalamus. Okay, and this is your little person. Okay, so if in your brain your left thalamus is destroyed, you will see features on the right side of your body. Okay, contralateral effects. If your right thalamus is destroyed, you will see features in your left side of the body. So they have written that destruction of thalamic nuclei result in loss of sensation on the contralateral side of the body, like on the opposite side of the body. So we go opposite, okay, for the body, but not for the face. Okay, now regarding the thalamic nuclei, this is your chart, and again a very important chart. This is on page number 498 of your first day 2020 book. Okay, study this chart. This is an important chart. We have this ventral posterolateral nucleus, VPL, and you see it gets the stimulus, or you can say input, from spinothalamic and dorsal column tract. So we have studied both of them now. Okay, the spinothalamic is the anterolateral one. Okay, and the dorsal column tract. Okay, and then they have also again given you the functions of it and where this input goes in the brain. So this destination is basically at the level of your brain. Okay, at the level of your cerebral cortex. Okay, cerebral cortex. So in your brain, this is at the level of cerebral cortex destination. So where the signals go, they go to the somatosensory cortex, primary somatosensory cortex, in ventral posteromedial nucleus, so VPL, VPM. In VPM also, the destination is same, but the sensations are of face and taste. Okay, so taste and face. So we will be studying the visual, in your BRS we have visual, we have auditory, we have taste also, I think we have smell also. So when we will studying that, we will be studying the VPM. Okay, so I'm not going in too much detail right now because ये सब आगे आएगा. So now trigeminal and gustatory pathways, there are two different pathways. For the face we know the trigeminal nerve, okay, and then another pathway, the gustatory for the taste. Also your facial nerve supplies to your posterior one third of your tongue also. Okay, so now the lateral geniculate nucleus and the medial geniculate nucleus, very important nucleuses. So now it's number 3 and number 4. So we will study tomorrow regarding this nucleus because our next pathway is vision pathway. So either on Friday or either on Saturday. Okay, we according to my schedule, I will tell you by today night. So our next is vision and neurophysiology. So we will be studying this number 3 then. So cranial nerve 2 is optic, okay, and then optic chiasm, optic tract. So we will be studying this all in detail, and the rod and cone cells, everything, pathway, okay. But the destination is primary visual cortex. So it is present in the occipital lobe, okay. It is present in your occipital lobe. So then you have a medial geniculate nucleus, okay, which we also call the olive pathway or olive nucleus also is present beneath it, and inferior colliculus of tectum. I will explain you every part, which is all these names which are coming when we will be like when I will teach you vestibular system, vestibular pathway, hearing pathway, then we will study this all, okay. And then the destination is auditory cortex of temporal lobe. So visual is at the occipital lobe, and the auditory, the hearing one, is at the temporal lobe, okay. And you can, like, they have given such nice mnemonics. So there is lateral geniculate and medial geniculate. So lateral is light and medial is music. So you can remember which one is for visual and which one is for hearing. And then you have number 5 is ventral lateral nucleus, okay. It receives the input from your cerebellum and basal ganglia. So now they are high up in your brain, and this is, now this is motor. So in the motor system we will study this. So up till the sensory system we will be studying these 4 nucleuses, and we have to study these 3, and we will study in the motor system this 4th, okay. So its destination is motor cortex. So what is a motor cortex? Your precentral gyrus. So motor is your precentral gyrus and sensory is your postcentral gyrus. So please remember these little things. These are very, very like basic of your neuro, okay. Then we have this another nucleus. No, they have given only 5 in this book. Okay, so we have this 5 nucleuses from thalamus. So you have to learn this chart. Okay, please learn this chart. And now let's see the homonucleus. So I have explained you the homonucleus also, and in your book also, in your first aid also, we have this homonucleus. I don't know if ऊपर था या नीचे था. Yes. So here is this, okay. Now you see this is the central sulcus, and this is, let's say this is because they have written sensory. So this is your post-central gyrus area, and this is your pre-central gyrus area. So this is your homonucleus. I have explained you in the previous lecture also. Let's see it once again. So this region is for your face. Okay, so eyes, nose, face, upper lip, lower lip, teeth, gums, tongue. Okay, all of your face things. And then this is your like upper limb. Okay, your upper limb up to here. Okay, so your thumb, your index finger, then your middle finger, ring finger, little finger, wrist, forearm, elbow, arm, shoulder. Okay, and then we have your head and neck. So this is your head and this is your neck. And then we have your trunk portion, and then your hip, and then your thigh, and then your knee, leg, ankle, foot, even toes. And then there is another section for your genital organs, but they have not drawn it here. So this is all your sensory homonucleus. you same have a motor homonucleus. Okay, and you see now this will be like if I will talk about the arteries, this will be like anatomy, but in this picture, because your the best part about your first aid is anatomy and physiology is given together. Okay, so this you can see the distribution of arteries too, that we have this anterior cerebral, posterior cerebral, and middle cerebral. So this little portion which supplies, which is receiving the innervation, the sensory stimulus, the input um from your sensory pathways to this region of your sensory homonucleus. So you see, the closer you are from the central sulcus, the region is anterior cerebral artery. Okay, but when you move to this region where your face and your upper limb and your head and neck is present, this region by the middle cerebral artery, and the posterior cerebral artery to the other regions of your cerebral cortex. So you have to like kind of understand the both the physiology and the anatomy together. Okay, if you want to clear your neuro part portion, neuroanatomy is asked a lot in your previous exams. So let's see what they have written. They have written very little things. The major somatosensory areas of the cerebral cortex is S1, S2. S1 has a somatotopic representation similar to that in the thalamus. Okay, so like the S1 and S2 is both, they have divided it into two. Okay, and then again they are representing it to the same, the thalamus, as we have the the thalamus with the nuclei. So kind of that. Okay, and then again this map which you see, this we call a homonucleus. Okay, so it's just a name. And the largest areas represent the face, hands, fingers, which precise the localization is most important. So nothing important is written over here. You just need to know that which areas in your sensory homonucleus. Okay, so if you remember the picture from here, if you remember this picture, you will remember like, okay, these regions for your face, and then for your upper arm, and for your head and neck, and for your lower limb, and then your genitals. So you will remember like everything. Okay, and then pain. So now they have separated this portion, but you have already read the pain pathway. Okay, what was your pain pathway? The anterolateral pathway for your was for your pain and temperature also. So let me go back to this page where we left. So you see, your pain and temperature was your lateral pathway of your spinothalamic tract. Okay, and then anterior was for your crude touch and pressure. So now if they are talking about pain, they are talking about these fibers, A, delta, and C. But A delta is fast, remember, and C is the slow ones. Okay, so please remember the fibers. So now they will be talking about the same things here. Pain is associated with the detection and perception of noxious stimuli. Obviously, we have these nociceptors which are called pain receptors. Okay, and the receptors are pain. The receptors for pain are free nerve endings in the skin, muscles, and viscera, but not all viscera. Please remember, I told you this concept in the previous class. Okay, neurotransmitters for nociceptors like pain receptors include substance P. Okay, now here like in this book there are some things which are not so clear, but I want to explain you two things. Okay, or you can write it in your book. For your fast conduction, the nerve fibers are A alpha. Okay, and they do not use this substance P. This substance P is for slow conduction. For fast conduction, your neurotransmitter for pain is glutamate. Okay, you can write it down. It is not written in this book, but you can write it down. Okay, it is glutamate. This is your neurotransmitter. First things first. Okay, fast conduction, A alpha fibers, neurotransmitter, glutamate. Okay, now when we talk about slow conduction, nerve fiber is C. Okay, ABC, C fiber, and the neurotransmitter is substance P. Substance P is a neuropeptide. Okay, it is a neuropeptide, substance P. It is made up of proteins. So it is a neurotransmitter too, substance P and glutamate. So please remember these two neurotransmitters. You will be learning more about this neurotransmitter in motor pathways too. Okay, in Alzheimer, in pathology also, in Alzheimer, in Alzheimer disease, or in Parkinson disease, or in other diseases. Like you will be studying these neurotransmitters too. Huntington disease, you will study this neurotransmitter. So people, please understand this. Okay, it is not written in your book, but the important points are the ones which I've just told you. So how your substance P is like the release of substance P or your pain receptors, why you give opioids, where opioids work, all this morphine you give, and in the hospital you give a set of opioids for the relief of pain for the patient. So all these drugs which you are giving that are opioid in nature, they work on the substance P. Okay, they inhibit the release of substance P. So the nerve endings do not release this neurotransmitter, and this neurotransmitter do not take signals anymore further, and no response is there. So when there is no response, there is no pain. So opioids work on substance P. So this is important. Okay, the thing I told you previously was important regarding the neurotransmitter. For fast it is glutamate, and for low it is substance P. And then the drug opioid inhibit the release of the substance P. Substance P, please remember this, it is written also over here. Okay, please remember this. Now again, they have discussed about this fast pain is carried by group 3. So the group 3 fibers are the A gamma and A delta, but A delta is for pain. Okay, not all fibers do not, all fibers which are in one group do not deal with a particular sensation. Okay, this is dealing with other sensation, this is with other. So A delta is dealing with your pain in group 3. Okay, it has a rapid onset and offset, obviously because they are fast, and is localized, so present at only at certain regions, and specifically at your free nerve endings of your skin muscles and some vistas. But the slow pain is carried by the C fibers, as I told you. It is characterized by aching, burning, throbbing. Now, let me tell you one thing. The fast pain is sharp in nature. You should also know the nature of pain. In your history taking, when the patient comes, you ask, na, pain is sharp or pain is dull. The pain is pricking, aching, burning, throbbing. What kind of pain? The character of pain. So you should know the character of pain. So the fast pain, the fibers which are taking A delta, which is taking the stimulus to this fast pain. What is fast? It is sharp and pricking in nature. For example, if you are pricked by a needle, the needle prick is a sharp pain, okay, and that is fast. But the slow pain is aching, like you are having ache in your stomach, or the burning sensation in your stomach or your epigastrium, okay, or the throbbing pain in your chest. All these pains are slow pain. Okay, so fast pain is basically because of the stimulus on the skin. So the fast pain is like because there is a destruction or distortion in your skin, but the slow pain is because of the destruction and distortion in your muscles. Okay, like it is deeper, okay. So if your muscles are destroyed, for example crush injury, for example blunt trauma, or the throbbing pain in your cardiac muscle, okay, or the aching pain, that is the sensations from the uh, viscera to the muscle, okay, the aching pain in your epigastrium. So all of these things are slow pain, but the problem is in the muscle. But in the fast pain, the problem is in your superficial epidermis, okay, in your skin, your stratum basale, basically. So please remember these things. This was all about your pain. And then there is one thing, I thought that we will study dermatomes today because there was this dermatome rule, but no problem, we will take it to the another class. The dermatomes are very important for your anatomy, okay, not for your physiology MCQs, but dermatomes do come in your anatomy, okay. So learn the chart for dermatomes from your first aid book, and we will study it in our next lecture. So referred pain is basically, we have two type of pain. We have, one is referred pain and the other one is radiating pain. So there is a difference in between referred and radiating. I'm just telling you the concept now. Okay, this will be our last topic for today. We are only left with 5 minutes. So if I'm talking about radiating pain, I am having this pain in my head, okay, and it is radiating to my face and to the neck, okay. Or if I'm having a pain in my heart, okay, so heart is on the left side and it is radiating to my left shoulder and to the left arm, so this is radiating. The pain is traveling, but referred is, I am having pain in my gallbladder and the same pain is I'm having on the tip of my right shoulder, because gallbladder, liver is present on the right side, right? So I am having pain in my gallbladder, okay, maybe the patient has gallstones, okay, and he is also having pain on the tip of right shoulder. So this kind of pain is referred. The pain is not traveling from here to here. The pain is present at two regions at the same time. Why? Because they same the same dermatome. The dermatome is C6 for both of them. Okay, so we will study the dermatomes, all the dermatomes, but for now you just need to understand what is referred and what is radiating. Okay, so people, here we are finishing our today's class, and tomorrow we will be studying dermatomes, and then we will be touching the vision pathway. Okay, and this is all about your today's neurophysiology class. Hope you enjoyed it, and please study for your exams. The next lecture will be on anatomy, okay, and I will update you regarding your anatomy, okay, in the WhatsApp group. Thank you so much, people. If you have any questions, you can ask me now also, or you can ask me in your WhatsApp group or anywhere, okay. You can ask me anywhere.